52. More traffic and weather coming up. For now, Lisa, back to you.
All right, Francella, thank you so much. If you are watching this, chances are you or someone you know is dealing with breast cancer. And now there's another complication that you need to be aware of. The American Heart Association now says therapies used to treat breast cancer can also cause serious issues for your heart, including possible heart failure. Here with more is Dr. Sunanda Pejavar. Good morning from Sharp. Good morning.
Good morning.
Okay, so you are a radiation oncologist. I'm assuming that you see this in your practice. Why is it that cancer patients, in particular females, breast cancer patients, deal with this more?
Well, you know, as you mentioned, the American Heart Association just came out with a scientific report discussing the effects of chemotherapy and radiation potentially on cardiovascular disease. Mm-hmm. This is important because cardiovascular disease is the leading cause of mortality in women, and with breast cancer, we're getting better and better at curing patients, and more patients are surviving breast cancer. So we really have to minimize the risks that chemotherapy and radiation can have on their cardiovascular health.
So what is it about the chemo and radiation that is so detrimental to the heart?
Well, there are different mechanisms for that. For example, with radiation therapy, the dose of radiation can be related to cardiovascular risk in the future. Mm-hmm. With certain types of chemotherapy, these agents can weaken the wall of the heart. And with certain types of endocrine therapies, hormonal blockers, there can be weight gain, and this can be an additional risk for cardiovascular disease.
Does it also matter for example, the proximity of the breast cancer to the heart? Does that matter as well?
Absolutely. We know that patients with left-sided breast cancers are particularly at risk for increased cardiovascular disease due to radiation therapy. There have been several studies on this, and at Sharp we do everything possible to minimize these risks in the future.
Let's talk about how to prevent this. I mean, I would imagine knowing that this is a risk is half the battle, but what is it that you can do if you are suffering from breast cancer or know somebody who is? What can you do to prevent the heart disease from also becoming a complication?
Well, at Sharp, you know, we use a lot of different techniques to minimize the risks that radiation therapy, for example, can have on cardiovascular risk. For example, we use a technique called the active breathing coordinator, or the deep inspiration breath hold. It's a non-invasive technique that decreases respiratory movement during radiation and also increases distance between the heart and the breast. So this allows us to minimize exposure of radiation therapy to the heart while still effectively targeting the breast.
That makes sense. Did the study say women are more at risk during the treatment, or is it also a risk after the treatment? After treatment is done, are they still at risk for heart disease?
It's more of a long-term issue. Okay. So it's a risk in the future of cardiovascular disease. Obviously, we monitor them very closely. In particular, with chemotherapy, certain agents can cause increased risk of heart failure, and they're monitored extremely closely. And they're, offered medications, and there are modifications made to treatment if that's present.
Mm-hmm. Gosh, as if breast cancer is not a hard enough diagnosis, then to have this as well, it must be tough. All right, doctor, thank you so much for your time this morning. We really appreciate it.
Thank you very much for having me.
All right, the San Diego Automotive Museum has a new exhibit that you can check out this weekend, and Dave Stahl is here to tell you, oh, look at these cool cars, tell you all about it after the break.